Intro to the application. This is about themes. So a theme is something that is repeated over and over again to send a message and involves both the art of caregiving and giving proper care. So it allows for more efficient care, it protects the rights of the resident, and it maintains the safety of the residents and staff. You are not supposed to be worried about healthcare costs. If you need something to do your job, it should be available to you. Okay? So if you're working in a facility that doesn't have the proper equipment, that doesn't have the proper supplies, that tells you it's too expensive to buy diapers, you need to let someone know. Okay? But the reason we have themes, it's not to lower the cost of healthcare, but it's just to make it more efficient. We are concerned about using supplies unwisely. So if you have, say, washcloths, you'll work at a lot of places that they use washcloths to wipe people's bottoms and then they throw them in the trash can. That is using your supplies unwisely. Washcloths are expensive. You should be using toilet paper to wipe off their stool and then use a washcloth that can then go to laundry to get clean. So it's not saying that we're not using our resources wisely, but cost shouldn't be a factor in providing good care. Okay? You should have those resources available so that you can give efficient care, that you can protect the rights of the residents, and that you can make sure that everybody stays safe. Okay? The themes of care, the first theme is going to be communication. So the residents have the right to know what is happening to them and what is happening around them. When you're giving your care, the first thing you're doing is you're introducing yourself. We already talked a lot about communication, but you're also going to explain what you're doing as best as you can to the patient. In the videos, you're going to see me telling a lot of stuff about why I'm doing this task or how I'm doing it or what I'm doing. You don't have to go that in depth with the patient, but at least let the patients know what you're going to do to them next. Okay? Autonomy. So autonomy means the right to make decisions. We talked about that already too. The autonomous means being independent. They're allowed to refuse anything they want to, but they also are allowed to make choices about what they do and do not want to do. Another theme of care is respect. Your simple courtesies that we've talked about, knocking on the door, saying please and thank you. Again, we live in the South. We say yes ma'am, yes sir all the time, but some people find that offensive. Some people don't want to be called yes ma'am. So if they don't like it, don't do it. I know it's habit. I say it all the time, but for some people it makes them feel old or they just don't really like it. So common courtesies and respect. Treat others as they want to be treated. If they ask you not to call them ma'am, don't call them ma'am. Okay? Maximizing your capabilities, emphasizing what the patient can still do. So if they can do it for themselves, encourage them to do it for themselves. Now, don't do everything for them if they can do it for themselves. You have to give them time to be able to do it independently. Don't get frustrated with them because they're taking 5 minutes to button their shirt and then just button it for them. Okay? Encourage them to work on, oh, you're doing a great job getting that button done. And then, here, let me help you with that last one. Or something like that, okay? So help them to the best of their abilities, but maximize what they still can do for themselves. Another theme is safety. Safety means being free from harm or free from danger. So most people want to make sure that their environment is safe. If they want their door shut at night, you can shut their door. If they want to leave a light on so they can get to the bathroom, you can leave the light on in the bathroom. So just different little safety things. We always make sure that their walkers and their wheelchairs and their canes are within reach for them to get if they need to get up and get out of the bed by themselves. We also have to make sure that their call bell is always within reach so that they can press the call bell to get someone to come and help them. Even if they get into the bathroom, there's a call bell on the wall in the bathroom that has a pull string on it. So when you're orienting them, you need to tell them about the one that's in the bathroom too. Your infection control is we're all in charge of trying to prevent the spread of infection. This just means making sure you are wearing gloves, handling bodily fluids as though they could be potentially hazardous, and then making sure you are diligent about washing your hands in between each patient. Even if you're working with someone, 2 people in the same room, in between each of those roommates, you go and get some hand sanitizer on before you do something with the other roommate stuff. Observing and reporting, like we said, you're the eyes and ears of nursing, so if you see anything abnormal, you're going to be paying attention to the details, and you're going to let us know. Some of the places have a little tool, like this one is called a stopwatch tool, and it's early warning signs of things that you may see. If you notice this going on with your person, you could report it on this stopwatch tool. It's an acronym or a mnemonic. The S stands for seems a little bit different than usual. T stands for talks or communicates a little bit less. The O is the overall, they need more help. The P is they're in pain. Anytime they say anything about pain, you need to report it immediately. The A is they ate a little bit less than normal. The N is they've had no bowel movements in the last 3 days. The D is they drank a little bit less than normal. The W is they've had a weight change. Most people aren't weighed every day, but some people have heart failure, we weigh them every day. Most people just get weighed once a week on a Sunday or Saturday. Some people only get weighed once a month. But if you're weighing someone and you notice they have a huge weight change, then we need to let someone know. Okay? The dietitian looks at their weights and charts that because the most important part of weight is nutritional status. We know if they're eating or if they're not eating, if their weight is fluctuating a lot. And weight bases upon their medications and things too. So weight is very important for them. The A stands for if they're agitated or nervous more than usual. The T stands if they're tired, weak, confused, or drowsy. The C, change in their skin color or skin condition. And the H is they're needing more help with walking, transferring, toileting, or anything more than usual. So that little mnemonic, in your 6-page checkoff sheet, there's a list of things that say these are what we're going to report to the nurse. And this is all of the things that you are just being observant for in that observation theme to make sure that if you notice any of that, you would let somebody know. Time management is important. We want to make sure we get our job done, doing it efficiently, but a lot of times this is the hardest one for new CNAs because it's new to you and you don't have your groove and you don't know how to do things or take shortcuts that are safe or get everything done, or you spend a little bit too much time with activities or talking to people instead of actually doing your job well. But as you work, the more experience you get, the better you'll get at time management skills. Okay, planning ahead, making sure you're prioritizing your tasks, organizing yourself efficiently is referred to time management. So your time management skills, when you get to work, you're going to plan out your day, and it's not always going to follow that plan, but at least you had a plan for the day. Get report. Sometimes places will let you, they're called overlapping shifts. So you work on overlapping shifts, but they're separate shifts. There's 3 separate shifts that overlap each other by about 10 or 15 minutes. During that 10 or 15 minute overlap, you're getting report from the CNA that's leaving, or you're giving report to the CNA that's coming on. And then you're able to share your ideas about the care of your patients. Some places make you do walking rounds where you go around with each other during that overlap and you actually tell each other, you look at the patients with each other so that you know everything is done. Okay. Sometimes they want you to check their briefs or their diapers and make sure they're changed and clean and dry. Or you need to lay eyes on the patient and make sure they're still in the building. So if you go around and do walking rounds and you can't find the person, then we need to let someone know. Okay. That's really a challenge in assisted livings where they're a little bit more independent and they're kind of all around the building and you don't really know where they're at. But every 2 hours, we should have accountability for we know this person is at least still in the building somewhere. Okay. Saving your time, helping you plan ahead, it prevents injuries. We don't want to leave the residents unattended. We want to keep checking on them every 2 hours to make sure that they are safe and that they're where they're supposed to be. Ethics, again, is the knowledge of what is right and wrong. So we all know about the code of ethics. Let's see. There is a code of conduct for C.N.A. So this code of conduct is for any basic job description. But in healthcare, we have ethical work ethics. Respect each person as an individual. Know the limits of your role and your knowledge. Perform only those tasks that you are legally allowed to do. So if a nurse asks you to do something that you are not allowed to do, you refuse it. Okay? Perform only those tasks that you have been prepared to do. If you have not checked off on using the new sling, do not use the new sling. Okay? If somebody gets injured while you're using the sling that you weren't checked off on, you both get in trouble. Okay? Perform no act that will cause anybody harm. Take drugs only if they're prescribed to you and supervised by a doctor. You can't take your husband's pain pill because you pulled your back at work. If you're not prescribed that medicine, you shouldn't be taking it. When you get injured on the job, anywhere you work, they do a job incident report, and a lot of times they do a drug screen before you get workman's comp. So if you have an injury on the job and they drug screen you, and then you have something in your system that is not prescribed to you, workman's comp will not pay you. If you have an incident on the job, you need to report it immediately so we can fill out that work incident. In case you need to go out on short-term disability, then workman's comp will pay you while you're out of work for an injury that happened on the job. If you go home and then call back the next day because you can't get out of the bed, if you didn't make an incident report at work, they don't know that it happened at work, workman's comp will not cover it. Okay? So even if you're pulling up somebody and you feel like you twisted your back the wrong way, just write a little incident report. It's just a piece of paper. If something comes of it, fine. If it doesn't, it just gets filed away. There's nothing that's not going to hinder your job or anything. But we need to know if you feel like something happened to you on the job the day that it happened. Okay? And then a lot of times if it's something like the lady who broke her wrist, we sent her to the emergency room. The hospital bills were paid by the facility. So, even if she didn't have health insurance, it was an on-the-job injury that workman's comp pays for your hospital bills. She wound up needing surgery. She was out for almost a year and then had injury to her wrist for still. So if she had not reported it right away, then we would have not known that it happened on the job. Carry out directions and instructions of the nurse to your best possible ability. Follow the agency's policies and procedures. Like I said, in a lot of these videos, you're going to hear according to your facility policy. Complete each task as safely as possible. Be loyal to your employer and coworkers, which we already talked about. Act as a responsible citizen at all times. That means if you get arrested outside of work, you have to report it to somebody. They have in Augusta that jail report, and believe you me, people look at that jail report. And a lot of times the other C.N.As would come up to me before I even knew that somebody was arrested, and they were like, "Did you see she was in the jail report?" Oh my gosh. So even if you don't report it yourself, somebody else is going to tell on you that you were in the jail report. Keep your person's information confidential, we've already talked about. Protect person's privacy. Protect person's property. Consider the person's needs to be more important than your own. Report errors and incidences at once and be accountable for your actions. So all of those things we've already talked about, but all of those things are going to be on your national exam for easy questions that seem simple, but that is the correct answer. Okay? Good code of ethics. You will lose your C.N.A. license if you are found to be in neglect of a person. If somebody accuses you of assault or neglect or some kind of abuse, there is going to be not a trial, but you get representation. Okay? People say things that aren't necessarily true. They accuse you of things. Maybe they took it the wrong way. Don't feel like you're going to get fired immediately and lose your license. There will be a hearing and not a trial, what just happened on the news, but you will have the ability to defend your honor or to say that it didn't happen or it wasn't the way that it was construed. Okay? So if you did abuse somebody, either verbally or physically or emotionally, then you will lose your license. Okay? But nobody's going to do that, so we don't have to worry about any of that, right? You will be unable to work in a nursing facility. You also will not be able to get any other medical associated license. Okay? So if you have a felony charge against you, a lot of times places in healthcare will not hire you. And that's any kind of felony. And that is just to protect the work environment and to protect the patient. You can incorporate themes into your daily work. So you have to get ready for your, get ready to do your task. You have to do the task, and then you have to complete or finish the task. So getting ready for the task is called your beginning procedures, and then actually doing the task, and then completing the tasks are your ending procedures. So on page 25, and on that handout where it says the top 10 things to remember, those are all beginning procedures and ending procedures that you're going to do with every task. So your common preparation or beginning procedures is always getting the supplies that you need, pulling the privacy curtain, checking the resident's ID, positioning the resident appropriately for the task, and then informing them of what you're going to be doing. Okay? You also have another handout in your purple folder that has a list of all the supplies that you need for each skill. I told you we're going to learn 22 skills that you're going to be tested on, but those skills have supplies that you have to grab to bring into the room with you as part of your beginning procedures. So that list of supplies is something that's just going to help you remember to bring all this with you to do your skill. If you forget something, it's fine. You can leave the room and go get it and come back. Okay? But you don't want to be in the middle of bathing someone and realize you forgot the towels or something, or there's no blanket to put on top of them or something. So that list of the other stapled together thing right there, that second one, is the list of supplies for each of your skills. And we'll go over those over and over and over again, so you'll know which supplies you need for each skill. And then always make sure you're pulling that privacy curtain. Okay.
The procedure. You will also need the following standard equipment and supplies: liquid soap, paper towels, trash can with step-on lid and plastic bag liner, gloves, and other personal protective equipment, or PPE, as required by the procedure and resident condition. As a nursing assistant, you will be called upon to perform a variety of procedures. While these procedures will have distinct features, the beginning and ending actions will be the same for each resident care procedure. This segment will teach you how to perform these critical beginning and ending procedure actions. Please refer to the steps mentioned here often until they become a part of the routine of each procedure you perform. Let's start with beginning procedure actions. First, you should assemble all necessary equipment and take it to the resident's room. This will help you improve the efficiency of the procedure and will ensure that you will not have to leave the room until the procedure is completed. Knock on the resident's door and identify yourself by name and title. Address the resident by name. Next, identify the resident by checking the identification bracelet or other means of identification according to facility policy. Ask visitors to leave the room and advise them where they may wait. Now you should explain to the resident what you are going to do and how the resident may assist. Answer any questions the resident may have about the procedure. This gives the resident the opportunity to learn more about the procedure and the extent of resident participation. Continue to speak with the resident throughout the procedure. Explain your actions and repeat instructions if necessary. Carry on a conversation with the resident. Provide privacy by closing the door, privacy curtain, and window curtain. Next, you should wash your hands, rubbing vigorously for 10 to 15 seconds. Set up the equipment for the procedure at the bedside. Open trays and packages. Position items in a location for convenient reach. Avoid positioning a container for soiled items in a manner that requires crossing over clean items to access it. Position the resident for the procedure. Ask an assistant to help if necessary, or support the resident with pillows or props. Make sure the resident is comfortable and can maintain the position throughout the procedure. Drape the resident for modesty. Next, you should apply gloves if contact with blood, secretions, excretions, non-intact skin, or moist body fluids other than sweat is likely. Apply a gown, mask, and eye protection if splashing of blood or moist body fluid is likely. Raise the bed to a comfortable working height. This will help prevent back strain and injury caused by bending at the waist. Lower the side rail on the side where you are working. When the beginning procedure actions are complete, you are ready to perform the necessary procedure. By memorizing the steps outlined previously and incorporating them as part of your routine, you will be better able to provide efficient, effective care to your residents. Your actions serve to protect the resident's dignity and rights, maintain a safe environment for the resident, and ensure safe working conditions for you and your coworkers.
Nice. There are a lot of test questions about that video, but it's all of the basic providing rights. You're providing efficient care, you're providing dignity, you're draping the person for modesty, you're pulling the privacy curtain to provide for privacy and dignity. You're maintaining a safe working environment by raising the bed to a comfortable working position for yourself. You're lowering the side rail on the side of the bed that you're on, or the attended side, so that you're not lifting yourself over the side rail or bending or reaching over top of a raised side rail. Ensuring that your work condition is safe for yourself. You're asking a coworker to help you if you need help. So all of those things just think about are part of your beginning procedures. They're all just listed here in your book. You have to check your care plan so that you know what equipment you're going to need. You're going to gather your equipment. You're going to knock for your privacy. If you work in an assisted living, people in assisted living that's their apartment, so they are in there, but they are also, like, some people are naked all the time, or some people, it's families, a husband and wife live together, and they could be doing something you don't want to see. So you have to knock and then wait for them to say it's okay to come in. Otherwise, you're going to see something you cannot unsee. Okay? But just because they're in a facility doesn't mean you just have free reign to just walk in their door and go in anytime. So give them privacy and make sure you're knocking and waiting for permission to come in. Addressing the resident by their name and then checking that second identifier. So like I said, in our facility, it's going to be a picture on their chart. They don't all have name armbands on. But you're addressing them by name, and then you're asking them to tell you their name, or asking them what they'd like to be called, and then identifying them by their two identifiers. Introducing yourself by your name and your title. Asking the visitors to step out if you're going to do something private. Explain the intent of your procedure. Make sure you wash your hands before you actually touch the patient. Put on your PPE or your personal protective equipment if you're going to be doing anything that involves blood or bodily fluids or water. Use your privacy curtains, privacy doors, adjusting the height of your bed, positioning the equipment, putting on your gloves, keeping the resident informed throughout the procedure. Making them a part of the procedure, letting them do as much as they can do for themselves. Your common completion steps. These are things that you're going to do when you're done with the procedures. So you're going to make sure that you put the call light within reach, and that is the last step of every skill. And that is one of the points with the skills, that if you don't give them the call light, it's either a yes or a no. And you don't want to fail a skill just because you didn't give them the call light. Okay? All of the skills are weighted differently. There are some bold steps in the skills that if you miss the bold step, you automatically fail. But the other steps are weighted, like you can miss so many of them. But you definitely don't want to get taken off and miss because that last step and you didn't give them the call light, and that was the kicker that made you fail that skill. Everybody should always have the call light within reach when you're done. Now, some people can't press the call bell, but there are little flat pads that you can give to those people that they can lean up against it or push it with their cheek or something. So there's always some kind of call signal that they can press themselves that needs to be within their reach. You'll be surprised sometimes we go to clinical and the call bell is like underneath their bed. Like it fell off the bed and it's under the bed. So they really don't want you to wrap the call signal around the side rail, because when you wrap it, the cords get shredded somehow. But there's a little alligator clip on it, and they want you to clip it to the pillow or clip it to the bed sheets or something so that it stays and doesn't fall on the ground. Make sure the bed is in a low position when you leave the room and that the wheels are locked so it's not going to roll around. Clean up anything that you have. Everything goes to soil utility. And then report any of your abnormal observations.
Now we will discuss procedure completion actions. Like the beginning procedure actions, these steps should become part of each resident care procedure. Remove your gloves and dispose of them. Check to make sure the resident is comfortable and in good alignment. Replace the bed covers, then remove any drapes used. Raise the side rails, if used, before leaving the bedside. Remove other personal protective equipment if worn, and discard according to facility policy. Avoid contaminating environmental surfaces with used gloves. Wash your hands. Return the bed to the lowest horizontal position. Open the privacy and window curtains. Leave the resident in a position of comfort and safety with the call signal and needed personal items within easy reach. Wash your hands. Inform visitors that they may return to the room. Report completion of the procedure and any abnormalities or other observations to your supervisor. Ongoing progress, care given, and observations are documented. This provides a legal record and provides other members of the interdisciplinary team with a record of what has been done. Both the beginning procedure actions and completion procedure actions demonstrated in this video will help you provide consistent quality care for your residents. As part of every procedure you will perform, it is vital that you commit these actions to memory and make them part of your everyday routine.
All right, does anybody have any questions? Your ending procedures listed right there too. Remove your dirty equipment to the soil utility area. You cannot wear gloves in the hallway. Okay, so put everything in a trash bag, but the outside of your trash bag is clean, so then you have just your hands carrying it to the soil utility room. You have to remove all of your PPE inside their room. So don't walk out into the hallway with gown, mask, and gloves on. Okay. You put the PPE on before you go in their room, but you take it off in their room before you come out into the hall. Hand washing, lower the bed, put up your side rails. You're only allowed to put up 2 side rails. You can't put up all 4 side rails because it's considered a restraint. But you can put up 2 of the 4 side rails. Some people like the top side rail up so they can pull up on it or use it when they're in the bed. And some people don't use side rails at all. So, ensure their comfort. Make sure the call bell is within reach. Open up the curtain. Tell the visitors they can come back in. And then after you've washed your hands, you're going to record and report your observations. Some places have paper charting, some places have kiosks or little computers to chart. Where we're going for clinical, they have little phones. Each C.N.A. gets a phone, and you can chart from the phone. So just make sure you're washing your hands before you chart. Any questions?